One of the main ways that our approach can help create long-lasting change in clients dealing with chronic knee pain from knee osteoarthritis, cartilage issues, other knee joint problems is by structuring your exercises in two different ways. And again, exercise is just one part of the overall puzzle. But when you're doing exercises, you can do exercises that are focused on calming the knee down, reducing pain, reducing irritation at the knee. And you can also focus on exercise where you're actually trying to build strength and endurance in the muscles around the leg to shift that stress away from the joint and into the muscles. Now, if you chase that too soon, you could overwhelm the knee. Now, if you only focus on gentle exercises, then you never actually build strength and endurance in the leg to make that long-lasting change. But the key is how you structure this across your whole plan and process. So one of the ways that we'd structure exercise here to calm the knee down is by modifying the way that you're doing activities day to day. Okay, now another strategy could be gentle joint mobility exercise to get some gentle movement in the knee. But as an example for modifying your activities, let's say walking is an activity that you feel more pain during or after. Well, that means we have to modify the way that you're walking. And let's say, for example, and we spoke about this in a previous video, you're landing on the whole foot and you're putting pressure on that knee too much too soon. And you've lost that ability to go from the heel to the whole foot to the toes. So we want to retrain that ability to land from the heel to the whole foot to the toes. So we might have you do something like this where we use a bit of support. We rock from the heels to the toes, and we go back and forth. Nice slow speed at the beginning, and then go a little bit faster. We of course want to start feeling a bit of work into our calves because that's the muscle we're trying to work here. And we can move from a double leg to a single leg option. But the key thing here is the focus is not necessarily on building strength and endurance through these muscles. It's to restore that ability, that skill of moving from the heel to the whole foot to the toes as you push off. Because if we can reduce the irritation on your knee during walking, then that will help everything else. Because if we focus on building strength and endurance in these muscles, but then you go back to walking and you actually re-irritate the knee again, then we're not going to get any long-lasting change. But this needs to be structured appropriately, okay? So if you're walking and you're continuing to irritate the knee, because you're not walking in the most appropriate way, then that's like picking a scab constantly. You're not giving it a chance to calm down, and it's not going to allow you to make that progress step by step through the process, okay? But it's also really important to understand that this exercise is not designed to build strength and endurance. We need to have a separate pathway to go down to build that. And that's why you have to move in a step-by-step process to actually make long-lasting change and understand what the clear goal of exercise is.